Hello and welcome to Ready, Set, Go, a webinar series sponsored by HUD's Office of Special Needs Assistance Programs. On behalf of SNAPS, I'd like to thank all of you for joining the webinar on changes to the Consolidated Plan Regulations. I'm Janet Pershing. I work at ICF International and provide technical assistance on a number of HUD programs, including ESG. I'll be moderating today's webinar for you. We are lucky to have two national experts serving as presenters on today's webcast. Michael Roanhouse is the Director of the Program Coordination and Analysis Division at the SNAPS office. He directs the Emergency Shelter Program, helps manage the HPRP program, and oversees policy on the homeless elements of the Consolidated Plan, HMIS, and the point-in-time and housing inventory counts. Kevin Kissinger is the team leader for technical assistance in the SNAPS office. He's on the Emergency Solutions Grants Program team, specializing in IDIS and the Consolidated Plan. In addition, we have two resource advisors available to answer questions today. Susan Ziff has been HUD's HPRP team lead and is now transitioning to take on the ESG team lead role as well. And Lindsay Stillman is a manager at Cloudburst Group, and she provides technical assistance on ESG, HMIS, and HEARTH. Today's webinar will last 1 hour and is being recorded. The recording will be posted next week on HUD's Homelessness Resource Exchange website, the HRE, at www.hudhre.info. The presentation slides for this webinar are already available on the HRE. If you'd like to have the PowerPoint slides available as we go through today's webinar, just follow the link you received in the GoToWebinar reminder email, or look at the chat box on your screen for a hyperlink that will take you to the slides. That URL is being sent to all participants right now. A couple of quick logistics things for you. First, because of the large audience today, all attendees will be on mute throughout the webinar. Second, if you're having any sound quality issues, try using a phone rather than your computer for the audio. If you have continued difficult hearing, or if you have trouble seeing the presentation, first try logging off and then logging on again, because that can often take care of the problem. If you've tried that but continue to have difficulty, use the GoToWebinar toolbar in the right of the View pane on your screen. Find there the dialog box in the Questions pane, and you can request technical support to get yourself connected. If you have questions during the webinar, you can use that same questions function we just talked about in GoToWebinar to ask a resource advisor. Your questions will be queued, and the resource advisors will answer them in the order they're received. Be aware, though, that sometimes we can't answer all of the questions that come in during the webinar. If you don't receive a response to a question during the presentation, please know that you can submit questions to the ESG Virtual Help Desk after the webinar. You can access the help desk through the HRE at the web address you see on your screen. To make sure the questions get to the right place, under Program/System, select Emergency Solutions Grants, and under the subtopic, select Consolidated Plan. With that, I'd like to hand the presentation over to Mike Roanhouse.
Thank you. Good afternoon, everyone. This presentation is intended to give CPD grantees an overview of the revised Consolidated Plan regulations presented in the Interim ESG Rule. It provides an overview of the changes required of all Consolidated Plan jurisdictions, as well as changes that are specific to Consolidated Plan jurisdictions that receive ESG funds from HUD. This presentation, of course, is not a comprehensive review of the Consolidated Plan. It is a high-level overview of the changes that are being accomplished by the interim rule. Next slide. One of the key purposes is to align the CON plan with the HUD Strategic Plan and Federal Strategic Plan to prevent and end homelessness. The regulations now specify certain types of strategies that must be included in the Strategic Plan and the Annual Action Plan, including goals and actions that specifically target the chronically homeless, veterans, families with children, and unaccompanied youth. Revisions also require that the continuum of care and related ESG recipients collaborate to develop consistent performance standards, and that reflects statutory and regulatory standards in the ESG rule proper. During this webinar, we will first discuss the changes that apply to all consolidated plan jurisdictions, regardless of whether or not they receive ESG. Changes also include items of specific interest to Emergency Solution Grants program recipients. We'll review those changes after reviewing the changes that affect all CON plan jurisdictions. In addition to requiring a high level of coordination and collaboration between continuums and states and cities and counties, the new regulation also emphasizes attention to certain subsets of the homeless populations in every phase of the consolidated plan process. For example, the needs assessment, strategies, annual actions, and reporting. These same 4 target groups will be played out across those different elements. HUD is also requiring that the consolidated plan incorporate additional information from the sheltered and unsheltered point-in-time counts of the homeless, the housing inventory charts that the continuums of care must complete, and HMIS data and other data sources. There will be more on this later in the webinar. Next slide. Here is an overview of the number of the consolidated plan jurisdictions in relation to the total number of those jurisdictions that are ESG recipients. Although only 360 of the consolidated plan jurisdictions actually receive ESG, many of the requirements of the consolidated plan regulation that will be discussed in this webinar apply to all 1,192 jurisdictions. There are actually about 432 separate continuums within those 1,192 jurisdictions. Next slide. The new regulations provide a more active role for the continuums in the process of creating the consolidated plan. All 1,192 consolidated plan jurisdictions are required to strengthen the homelessness needs assessment and strategy in their consolidated plans. 432 continuums of care must participate in consolidated plans within their geographies, and those continuums of care must provide performance data for ESG-funded projects in their geography. In addition, the 300 jurisdictions that are ESG recipients and their subrecipients must participate in the continuums HMIS covering their locations. Now, Kevin will be reviewing the regulatory changes affecting all CON plan jurisdictions. Kevin?
Thanks, Mike. So the next session, we're going to cover the regulatory changes that affect all consolidated plan jurisdictions, regardless of whether or not they receive ESG. So the changes we described here in this section will affect all 1,192 CDBG jurisdictions that submit a consolidated plan, not just the 360 jurisdictions that directly receive emergency solutions grant funds from HUD. Next slide, please. So the new regulations make a number of changes related to the consolidated plan. I think we need to back up a slide to slide 12, please. The changes are going to include changes in definitions, changes in the consultation requirements, data in the housing and homeless needs sections, including the housing market analysis, and some additional detail and areas of focus in the strategic and action plans related to homelessness. Finally, some changes are going to include reporting on those strategies and actions in the Consolidated Annual Performance and Evaluation Report, otherwise known as the CAPER. So remember, once again, these changes are required of all 1,192 jurisdictions that will submit a consolidated plan, regardless of whether or not they receive ESG funds. So we're going to review each of these changes in the next few slides. Next slide, please. So first, as you may be aware, HUD has recently released a regulation that clarifies the definition of homelessness. The first change to terms used in the Consolidated Plan regulation is related to that clarified definition. For the first time, we have a definition of at risk of homelessness. So at this time, you should be aware that the Consolidated Plan, you can specify certain characteristics that would cause someone to be defined as at risk based on the unique circumstances or needs in your community. HUD is allowing local discretion regarding the housing characteristics associated with instability and an increased risk of homelessness, which the jurisdiction identifies as an important risk factor that's not otherwise covered in the at-risk of homelessness definition. We will be giving you a lot more information on this subject in a webinar on the definition of homelessness and the definition of at-risk of homelessness. That webinar right now is tentatively scheduled for December 13th. Next slide, please. So other key definitions provided in the regulations are a definition of chronically homeless and continuum of care. We also have clarified the definition of emergency shelter. We've defined rapid rehousing assistance, defined homelessness management information system, and victim service provider. So for the exact definition of these terms, see the regulations. Next slide, please. Okay, regarding consultation requirements, we've made changes, and the goal of those changes is to create a more direct connection between the Consolidated Plan and the continuum of care process, as well as increasing access to mainstream services for people experiencing homelessness. With the HEARTH Act amendment to the McKinney-Vento Act, jurisdictions are now required to consult with each continuum of care that serves the jurisdiction's geographic area, among other groups that are impacting homelessness, when the jurisdiction is creating a homeless strategy and the resource allocation to address the needs of people experiencing homelessness. In addition to the continuum of care, all jurisdictions must also consult with public and private agencies that provide housing, health services, social services, victim services, employment services, or education needs of low-income and homeless individuals and families. They also must consult with publicly funded institutions and systems of care, which may discharge persons into homelessness, and business and civic leaders when preparing the strategy to address homelessness. Next slide, please. Okay, now the housing needs assessment. Within the Consolidated Plan, jurisdictions are required to provide a concise summary of the housing needs of extremely low to moderate income individuals and families, as well as the nature and extent of homelessness in the jurisdiction. The intent of this needs assessment is to appropriately target the strategic plan and annual actions to those most in need. Because individuals and families that are at risk of homelessness are now eligible for certain services, jurisdictions must estimate the number and type of formerly homeless families and individuals who are receiving rapid rehousing assistance and nearing the termination of assistance in the housing needs assessment. So in order to gather this data for the Consolidated Plan, jurisdictions will need to consult the state and local HPRP grantees to determine the number of families that may fall into this category within their jurisdiction. Next slide. In the homeless needs assessment, jurisdictions are now required to describe the nature and extent of sheltered and unsheltered homelessness, including rural homelessness, within the geographic area of their jurisdiction. This includes the number of people that are homeless at one point in time, the number of people who lose their housing and become homeless each year, and the number of people who are exiting homelessness each year. The narrative must also include the number of days that persons experience homelessness and other measures which HUD specifies. The description must include the types of housing characteristics that have been linked with instability and increased risk of homelessness. At a minimum, the recipient must use data from the local homelessness management information system and the point-in-time count conducted in accordance with HUD standards. The good news is that much of this data will eventually be pre-populated for a jurisdiction when the Consolidated Plan is made part of the Integrated Disbursement Information System, known as IDIS. Formula grantees currently use IDS to draw down program funds. Next slide, please. Continuing with the homelessness needs assessment, I want to point out again, there's an emphasis on data on chronically homeless individuals and families, families with children, veterans and their family, and unaccompanied youth. Next slide, please. In the homeless needs assessment, jurisdictions must now include a narrative description of the characteristics and needs of low-income and extremely low-income individuals and families with children who are housed but threatened with homelessness. And again, this description must include the types of housing characteristics that have been linked with instability and an increased risk of homelessness. Next slide. Okay, on the housing market analysis. One requirement of the housing market analysis section of the Consolidated Plan is an inventory of the facilities and services available to meet the need of people experiencing homelessness. The new regulation adds housing, including emergency shelter, transitional housing, and permanent supportive housing. Continuums of care are required every year to conduct an inventory of such housing, so this requirement links it to the needs and strategies in the Consolidated Plan. In addition, jurisdictions must now include mainstream services that complement targeted homeless services in the inventory of services. Examples are health, mental health, and employment services. This requirement is consistent with the overall emphasis on using and collaborating with mainstream assistance programs to prevent homelessness. Further, these changes will assist in creating consistency between the consolidated planning process and the continuum of care planning process and activities. Finally, the inventory now emphasizes the needs of homeless persons within the jurisdiction, particularly chronically homeless individuals and families, families with children, veterans and their families, and unaccompanied youth. You'll see in the regulation that those four categories of homeless persons are going to be repeated several times. Next slide. Okay, so there's a number of different sources of data that jurisdictions can use to supplement the data that's going to be provided in IDIS for the housing and homeless needs assessment, as well as the housing inventory. Many of these data sources are related to the continuum of care. For example, the Continuum of Care Notice of Funding Availability provides information about the performance of the continuum of care towards ending homelessness, as well as information about the most recent point-in-time count of the homeless, broken down by various categories, for one night during the last week in January. Other data that all continuums compile include the Housing Inventory Chart, which provides data about the emergency shelter, transitional housing, and permanent supportive housing within the continuum of care. A jurisdiction can use HMIS data to provide a wide range of information about the individuals and families receiving services. The extent of information available varies by community, but for an overview of the HMIS data elements, visit www.hmis.info. That's www.hmis.info. Or contact the HMIS lead agency in your jurisdiction if you know who that is. Other sources of data and accomplishments reported can be reported in the annual and quarterly reports from a jurisdiction's HPRP program. Another example would be if your jurisdiction has a 211 system, you might be able to collect information about the number and demographics of people calling for housing or homeless assistance. Some jurisdictions may also choose to survey providers or use survey data collected by other planning groups. As a final example of a data source, you could look to the Housing Authority, Regional Commission, or state or local government for information about different services that they provide and the number and demographics of people they've served. Next slide, please. As a reminder, I mentioned earlier that HUD is implementing and including some data regarding the Consolidated Plan in IDIS. It actually is an electronic submission template for the Consolidated Plan and Annual Action Plan, which should be available sometime in the spring of 2012. So much of the data that's required in the housing and homeless needs assessments will eventually be pre-populated in IDS for each jurisdiction. This should help you save some staff resources, since much of this required information then will be pre-populated. Use of this electronic template will help jurisdictions more easily connect their 3 to 5 year goals with the annual activities and outcomes in their annual action plan. The template will pre-populate tables with data from the point-in-time counts of the homeless and the housing inventory data required in the continuum of care application. For some jurisdictions, it will also include more longitudinal data from HMIS for jurisdictions that participate in the annual Homeless Assistance Report to Congress, known as the AHAR. Also, since IDS is providing more data in more detail, HUD is building a data mapping tool which will help make this data more easy to understand and manage, support the needs assessments and strategic decision-making regarding the needs that are presented, and provide a library of pre-populated maps and reports with flexibility for you to customize that locally. So now I'm going to turn it back over to Mike to tell us about the strategic plan elements of the Consolidated Plan.
Thanks, Kevin. To better align the Consolidated Plan with the HUD Strategic Plan and the Federal Strategic Plan to Prevent and End Homelessness, jurisdictions must address specific types of strategies in the Strategic Plan section of their Consolidated Plan. Jurisdictions must include the 4 following type of strategies: reaching out to homeless persons in needs assessment, especially of unsheltered persons, addressing needs of people in emergency shelter and transitional housing, helping homeless persons transition to permanent housing with an emphasis on the chronically homeless individuals and families, families with children, veterans and their families, and unaccompanied youth, and helping low-income individuals and families avoid homelessness. Next slide. Jurisdictions must describe assisting homeless individuals and families make the transition to permanent housing and independent living through shortening the period of time they are homeless, facilitating access to affordable housing, and preventing returns to homelessness. Next slide. Jurisdictions must describe their homeless prevention strategy, particularly for those individuals and families being discharged from publicly funded institutions and systems of care or receiving assistance from public and private agencies. Next slide. The strategic plan provides a short summary of the institutional structure, private industry, nonprofit organizations, public departments, and institutions through which a jurisdiction will carry out its plan. The new regulations add several additional types of institutions that must be described, including the continuum of care, philanthropic organizations, public institutions, and departments and agencies. In addition, the summary must elaborate on the current assessment of the strengths and gaps to the delivery system by describing how the jurisdiction will overcome identified gaps in order to carry out its strategy for addressing priority needs. Next slide. Additionally, the summary of coordination in the strategic plan makes changes to help strengthen the collaboration between consolidated planning jurisdictions and the continuum of care. The jurisdiction now must address the involvement of the continuum of care, efforts to coordinate housing assistance and services for homeless individuals and families, and the means of cooperation and coordination among state and units of local government with the implementation of the consolidated plan. Next slide. Now turning to the annual action plan core elements. Within the annual action plan, jurisdictions must now describe its one-year goals and specific action steps for reducing and ending homelessness within 4 specific areas.
Justin, you're one slide ahead. Can you move back to the previous slide, please? There you go. Thank you.
These 4 areas, which are identical to the categories in the strategic plan, include reaching out to homeless persons, especially unsheltered persons, and assessing their individual needs, addressing the needs of people in emergency shelter and transitional housing. Next slide. Assisting homeless individuals and families make the transition to permanent housing and independent living. Again, we're tracking this by the major identified target groups in the federal plan. That is the chronically homeless individuals and families, families with children, veterans and their families, and unaccompanied youth. We're doing that through shortening the period of time of homelessness and facilitating access to affordable housing. And next slide. Helping low-income persons avoid homelessness, especially those with extremely low incomes who are likely to become homeless after being discharged from publicly funded institutions and systems of care and receiving assistance from public and private agencies. Next slide. And the regs provide for addressing the housing and supportive service needs of people not currently homeless but who are having special needs. Notice that these actions correspond with 3 to 5 year strategies in the strategic plan portion of the consolidated plan. The same groups are emphasized in the needs assessment and the strategic plan. Next slide. Now moving to the performance reporting, the CAPER requirements. All grantees that submit a consolidated plan must also include additional information in their CAPER. All jurisdictions will be required to include the number of homeless persons served in addition to the current categories of persons served. In the homeless prevention section, jurisdictions must evaluate the progress made in meeting their objectives for reducing and ending homelessness using the strategies specified in their strategic and annual action plans, including outreach and assessment, emergency shelter and transitional housing, and helping homeless individuals and families make the transition to permanent housing and independent, and homeless prevention. Now we are going to have a poll quiz. Janet?
So here's your chance to pause for just a minute and take a quick quiz. The question you're being asked to answer is whether the changes in the Consolidated Plan regulations only apply to jurisdictions that receive Emergency Solutions Grants funds. True or false? Do the changes only apply to those who receive ESG funds? True or false? And here are your poll results. Almost all of you got this right. It is in fact false. Although there are some changes that are specific to Consolidated Plan jurisdictions that receive ESG, many changes apply to all of the Consolidated Plan jurisdictions. And in fact, all of the changes we've heard about so far today apply to all Consolidated Plan jurisdictions. To learn a little bit about the changes that apply only to Consolidated Plan jurisdictions that receive ESG funding, let me turn things back over to Kevin Kissinger.
Okay, thanks, Janet. And I will continue on this exciting subject. And this time we're going to talk about the changes that apply only to Consolidated Plan jurisdictions receiving ESG funding. So these requirements do not apply to Consolidated Plan jurisdictions that do not receive ESG funds directly from HUD. Okay, so now we're going to look at the changes for ESG recipients that relate. Let me restate that. The changes for ESG recipients relate to details that must be provided in the actual annual action plan. These changes include the development of standards for administering new ESG activities, the use of a centralized or coordinated assessment system if the continuum of care has a system that meets HUD requirements. Changes also include outlining a clear process for making subawards and creating performance standards for grantees in consultation with the continuum of care. In addition, there are changes to the required consultation with continuums of care as well as to the ESG portion of the CAPER. So we're going to look at all of these changes in the next few slides. And again, these changes are only for jurisdictions that receive ESG. So in the annual action plan, next slide please, jurisdictions must describe the standards they will use for administering ESG. These standards must address issues such as who will receive assistance, participant contribution, and the extent of service allowable. HUD will be posting additional guidance on this subject on the Homelessness Resource Exchange, and Janet will give that web address at the end of this presentation. The citations listed there are where you can look for some more information on this subject. Next slide, please. Now let's talk about the centralized or coordinated assessment system. If the continuum has one that meets HUD standards, jurisdictions must describe the centralized or coordinated assessment system that will be used in their community. This may include a community referral hotline, a central screening location, or some sort of technology-based screening tools. There's a wide variety of centralized or coordinated assessment types of systems available. It could just be as simple as a common form used by every provider. Next slide. In the annual action plan, jurisdictions must describe their process for making subawards, and also describe how the jurisdiction intends to make awards available to nonprofit organizations or local units of government for urban counties. ESG recipients should note that IDS now tracks commitments and draws at the subrecipient level, and there will be a webinar that's currently planned for December 6th that will provide everything you've always wanted to know about IDIS and the new Emergency Solutions Grant Program, and it will show you how IDS is now tracking commitments at that subrecipient level. Next slide. So let's talk a little bit about the performance standards I mentioned earlier. The jurisdiction must describe these performance standards for evaluating ESG activities. These performance standards must be established in collaboration with the continuum of care. The development of such clear performance standards for ESG activities will allow jurisdictions to more effectively meet the goals and objectives identified in the strategic plan and action plan sections of the Consolidated Plan. Next slide. So continuing with the annual action plan, jurisdictions that receive ESG funds must also consult with their local continuum of care when designing the ESG program. Consultations must include the allocation of resource by type of activity and geographic distribution, development of performance standards, as I mentioned on the previous slide, and the evaluation of outcomes of ESG activities. So again, the consultation with the continuum of care is going to be important. Be sure that you're also consulting with continuums regarding developing the funding, policies, and procedures for the operation and administration of HMIS. Next slide, please. Finally, certifications. I'm not going to read the slide, just know that generally jurisdictions must provide a number of certifications when submitting their consolidated plan. We're not going to review the required certifications in detail on this webinar, but just keep in mind the ones on the slide that are listed are either new or they've changed. So again, for more specific information on these specific certifications, refer to the regulations. Next slide, please. Okay, let's talk a little bit about the Consolidated Annual Performance and Evaluation Report, the CAPR. If you're an ESG grantee, you must now report the following items: the evaluation of progress in meeting specific objectives for reducing and ending homelessness, the number of persons assisted, the types of assistance provided, and outcomes data measured under the performance standards you developed in consultation with the continuum of care. And yes, HUD will hold yet another webinar devoted to this subject at a further date. All right, Janet, it's time for the second quiz question.
Alrighty. This time we're going to have a multiple choice question. The question is, on which of the following will emergency shelter grants recipients need to consult with the continuum of care leadership? Allocation of ESG resources, development of performance standards for ESG recipients, HMIS funding policies and procedures, or all of the above? And there are results. Most of you selected all of the above, and that is in fact accurate. ESG recipients and COC leadership need to collaborate on all three of these activities. It's very important for you to be thinking about all of these elements as you're moving forward. Okay, let me turn things back over to Kevin for a few more important items.
Okay, I can hear some people hyperventilating out there, so I just want to assure you we know this is a lot of information, and please know that HUD is phasing this in slowly. We're not going to expect you to walk out the door tonight and have a consolidated plan redone for us tomorrow. So we're going to have a lot of guidance and webinars on some of these subjects. Janet will give you some information on that later. But regarding this slide on further guidance, remember that for FY 2011, HUD is providing two allocations of Emergency Solutions Grant funds. The first allocation that nationally was $160 million occurred over the summer. And the second allocation, which was recently announced, coincided with the publication of the Emergency Solutions Grant Interim Regulation. So for this second allocation, ESG recipients are going to be required to use at least some of their ESG funds from the second allocation for rapid rehousing, rental assistance, and other new eligible activities. HUD is developing and will shortly publish a notice specifying the requirements for receiving the second allocation of the fiscal year 2011 ESG grant funds that include reprogramming funds from the first allocation. Next slide, please. Many jurisdictions already have a formal or informal way that the entity responsible for the consolidated plan interact with ESG grantees and continuums of care. However, some continuums of care may not be aware of which state or local agency is responsible for preparing the consolidated plan, or that the consolidated plan actually drives a number of strategic and funding decisions that affect homelessness in their area. So it's going to be very important that substantive discussions between jurisdictions and the continuum of care occur as soon as possible. Jurisdictions that receive ESG funds directly from HUD should be consulting with the continuum of care and other organizations that will need to prepare and receive the second allocation of FY 2011 ESG funds. Jurisdictions that do not receive ESG directly from HUD, as you've seen already in the presentation, still have items they need to consult with, so they should begin discussions with the continuum of care also in order to begin planning for their next annual action plan. So now I'm going to turn it back to Janet to finish off this presentation.
All right. So we have promised you a couple of times that there is going to be more information for you. I'm going to tell you a little bit about that. First, to get further information about the changes in the Consolidated Plan Requirements, there are some resources that are available right now and some that will be available to you soon. These include the published ESG Interim Rule, which includes the Consolidated Plan changes, and a version of the Consolidated Plan regulation that highlights the changes that come from the ESG Interim Rule. There's also the upcoming notice that will talk about requirements for receiving the FY 2011 ESG second allocation that Kevin just talked about, and additional Consolidated Plan guidance that is currently being developed, including a user guide and some frequently asked questions that all will be posted on the HRE. In addition, HUD is currently working to produce a number of other user guides that will help communities implement their programs under the new ESG regulation. The resources will eventually include not only the user guides, but also the McKinney-Vento Act as amended by the HART Act, all of the published program regulations, these webinar recordings, and at-a-glance charts, sample forms, and similar sorts of tools. All of these will be made available on the HRE as they become ready, and the communities will get alerts so that they know to go to the HRE to look for the information. The address for the HRE, again, is www.hudhre.info. In addition, the ESG Help Desk is now operational and can be accessed through the HRE to get your individual questions answered. There will also be some additional ESG-related webinars. We want to make sure that you're all aware of what's coming up over the next few weeks. As usual, all of these webinars will be recorded and posted to the HRE, so you'll be able to access them after their broadcast if you can't participate on Tuesday afternoons. The remaining 4 webinars in the ESG series include ESG-eligible activities, which will cover program components and activities, and that'll be next Tuesday, November the 29th. We'll then have IDS online for ESG on the 6th of December, homeless and at-risk definitions on the 13th, and general administrative and program requirements on the 20th. So let's turn back for just a moment to think about the objectives of this webinar. You should now be able to describe the key changes to the Consolidated Plan regulations that apply to all Consolidated Plan jurisdictions, as well as those that apply specifically to Consolidated Plan jurisdictions with ESG allocations. Please take a couple of minutes to complete the online survey that you're going to be getting via email, and let us know how well this webinar achieved those 2 objectives. And also, please give us ideas you may have about how to improve those future webinars. Thanks very much to our panelists today, Mike and Kevin, and to our resource advisors, Lindsay and Susan. Please remember that the PowerPoint presentation you saw today is already posted on the HRE, and a recording of this webinar will be available on the HRE next week. As a reminder, if you have additional questions, please feel free to submit them via the ESG Help Desk, which you can find on the HRE. Please join us next week for the ESG Program Components and Activities webinar. And thanks again very much